Hi, good afternoon. I'm Rachel Fredman. Host is out for the day, so I'm going to be interviewing our guest today, Ruth Krystolpolski, and I'm going to introduce her right now. Hi, Ruth.
Good afternoon, Rachel. Nice to be here. Thank you for having me.
Thank you for being here. Can you tell us a little bit about yourself and your background and
Sure.
your journey to where you got?
Yeah, I have been blessed for the last 30 plus years to work in healthcare. Started right out of graduate school with a real passion around how healthcare financing and delivery kind of meet each other. And so I've worked in large integrated delivery systems the entire 30 years, really focusing on provider-sponsored health plans. So I started several provider-sponsored health plans, as well as care innovation, population health, and all kinds of other kind of entrepreneurship in healthcare, typically using data and IT, right, to improve the care that we're providing to our patients and our communities. So that's been my journey. I've had the opportunity to work in most of the different parts of the country. So I've been able to experience how healthcare is delivered and paid for across many of the regions of the country.
Okay, well, thank you. That's great. And I guess, can you tell us a little bit, given your 30 plus years in healthcare and, when it comes to data, how organizations can strike a balance between wanting to have more data, but also having better quality of data?
Yeah, I think, as we think back to kind of the advent of collecting data in healthcare, right? We started mostly on the financing side and payment side of healthcare, back in the early 1990s to mid 1990s, and then really started to think about clinical data and capture of clinical data in the early 2000s with, meaningful use and the advent of EHRs. And I think historically people think it more is better. But I think as we're thinking about data and healthcare, better is better. And really being thoughtful around what data is important to actually impact clinical outcomes, and then how do you standardize those data sets in meaningful ways so that they can be used in workflows, right? And so actionable data to clinicians and team members who are working with patients, as well as consistently provided data to our patients, is really important. And I think sometimes we focus on more instead of better. And then we get tripped up, right? Because more is often more expensive too.
Right. So I guess you mentioned that like clearly defining what the problem is before you go out for the data. Can you just elaborate on that a little bit more?
Sure. So, again, I've had the wonderful opportunity of working with various types of provider networks and organizations, often who are using, different underlying platform technology or structures, so different EHRs. And the very first thing everyone will say is, well, let's just do EHR integration, right? Like, let's do end-to-end EHR integration, which is, quite frankly, nearly impossible and really expensive. And so understanding very clearly, what action or what outcome you're looking for can then thread the needle back through what data do you need, right, in order to understand what interventions are necessary. And so I always tell folks, like, think through what's the minimum data set necessary in order to answer the question that you're trying to answer, and then what are the easiest ways to get that information. And sometimes that's not always full, right, EHR integration.
Makes sense. Can you share some examples of how various startups with great solutions often exist if they don't integrate the Salesforce into their broader ecosystem?
Yeah. So as we think about, some really, really, I would say, elegant solution providers out there, if we're not thinking about how it fits within the broader both healthcare ecosystem, the reimbursement ecosystem, the regulatory ecosystem, as well as the data, right, and the data construct ecosystem, you can have a really, really elegant solution that can't be used because it doesn't either have a way to pay for it, right? It doesn't connect easily to other systems that are being used. Or it doesn't it can't be used within a large health system enterprise. And so I think really understanding who it is that is your customer, and sometimes that's more than one person, Rachel. So sometimes the customer could be the end user patient. The customer might be the end user patient, and the health system might be the end user patient, the health system, and the payer, right? So understanding who the customer is and then how you fit within that broader ecosystem from a payment, a regulatory, and then a data flow, data connection standpoint is really important.
Thank you. And can you give us some examples of like strategic or strategies or technologies that can help bridge the gap between the data silos and improve integration?
Yeah, and so I've been, I can remember I did my first EHR implementation in 1999. So that tells you how old I am. And we were talking back then about standard connections and standardized data collection. And I did a large project at one point in time with a biobank, right, and collection of pathology samples. And there was no singular way to annotate and capture data around something as simple as pathology samples. So you start to think about rolling up tens of thousands or hundreds of thousands of pathology samples without standard annotation, right, which then can be captured in standard data sets, which then can be used to make decisions. You struggle with actually getting an optimized solution. And so I would really hope that over this next decade we double down on standardization of data sets and standard ways of transmitting data. Again, when you go back to things like the ANSI standard transaction sets and simple things like processing and paying for healthcare services, we've had those standards for 2+ decades, and yet we're still trading what I would call simple files around payment in non-standard ways, right? And that adds cost and complexity and doesn't allow us to truly use technology in healthcare to better impact our patients. So I think standard definitions as well as standard ways of transmitting and transacting data back and forth is going to be really important.
That's fascinating. Wanted to talk to you a little bit also today about how having women in leadership roles contributes to more patient-centered care, especially for females.
Well, I can remember times when I was the only female in a leadership room, if we go back a while, and that has absolutely positively changed, right? In most healthcare organizations, more than 80% of the workforce is women. So we would expect that there would be a commensurate number of women in leadership positions. And I think only over the last decade or so has there been a strong focus on that. I do think as women make most of the healthcare decisions in the country for themselves and their families, having a woman's voice at the table around, right, how healthcare is delivered, how people access it, and how technology can be used to improve it is very, very important. And so I think we're better in healthcare because we have women's voices around the table.
Great. And yes, it's so nice that we do have more women. Can you maybe share some examples of stereotypes that exist in healthcare that would be changed or challenged through having more representation by females?
I don't know if it's just specific to healthcare, but I think, in general, if you're a a strong, confident woman who is open to bringing your voice to the table. Sometimes you're seen as aggressive, right? Whereas a man that shows up in the same way is often seen as, you know,
Right.
competent and confident and all those kind of things. And I think as we bring more women to the table, right, with the, you know, the willingness, the ability, and the capability of bringing ideas forward, voicing opinions, we begin to break some of those stereotypes down little by little. So
Great. And how can diverse role models inspire young women to pursue careers in healthcare, and as well as STEM fields?
yeah. So, you know, I think back to when I was a young child. My role models, particularly for healthcare, were four of my grandfather's sisters were nuns. And they actually, three of the four actually worked in healthcare for a religious order. And so as a really small child, I would be, you know, taken to their workplace, which were nursing homes and hospitals, to see them. And I had this opportunity to see these really smart women doing really, really important work, and they loved it, right? And for me, you know, I entered, and again, showing my age, I entered high school and was a candy striper, right? And so we don't let high school children in hospitals now to volunteer, but I would go to the hospital every chance I would get, put on my little red and white candy striper outfit and wander the halls and see the work that was occurring there. And really that exposure, right, made a huge difference in making decisions around what I wanted to do and what I was interested in. So I think we have to work even harder now because we don't have some of the opportunities for young people in a direct kind of, you know, on-site experience, to continue to expose them to opportunities both in healthcare and in STEM. And I think the younger that we can do that, the better it will be. There weren't a lot of, you know, girls in, you know, calculus and physics when I was in high school. But being exposed to those things, right, consistently allows us to think about what's possible. And we need to continue to provide those opportunities to young women so they know what's possible.
Great. I'm just going to look at the questions from the audience.
Sure.
Someone asked how you manage being a compassionate leader and drawing the line when needed.
You know, I've been studying compassionate leadership this last year, so it's such a wonderful question. There's a new book out by Donato Tremato called The Compassionate Leader. And it's all around kind of improving it's called the double bottom line, right? So caring for and being kind to the people that you work with, and who are on your teams. As well as doing well, right, from a financial standpoint. And there's actually research now that suggests that there's a tie between the two of them. I think the world is often not kind, and it feels like it's less kind, even more recently than maybe in the past. And bringing kindness to work while being fair, right? And having, you know, holding people accountable is very, very possible. And I think it does create an environment where people want to show up and do their best. And I try to do that every day.
That's great. And I guess one of my questions is, if you were to give advice to someone, you know, a young female who wants to be a leader in the field, what advice would you give them?
Well, I always tell everyone, I think the hardest thing to do in healthcare in particular is to be brave. You know, brave around voicing your opinions, right? Brave around bringing ideas forward that might be different than the status quo. Brave about engaging in opportunities where you continue to learn and grow. And every single advancement that I've had in my career or opportunity I've had to do something new or different, and learn has been like at one of these moments of being brave, right? And sometimes it feels like, you know, when you look back, you're like, wow, that was probably reckless. And I'm sure my parents thought I wasn't thinking things through. But I think that ability to be brave and to be confident, right? I think we often as women undersell ourselves and our capabilities. And I would just encourage everyone to take chances, right? And continue to learn. And you'll never get tired of all of the things that are possible in healthcare right now. There's so many opportunities to do a variety of things. And many of them are extremely exciting and impactful, right? Again, to the communities that we serve and to the patients that show up every day for us to take care of them.
Right. Thank you. One other question from the audience is, why is it important to learn from our mistakes? And do you have an example where you learned from a mistake and made you a better leader at that mistake?
We don't have enough time to talk about all of the mistakes that I've made over 30 plus years. But again, I think our greatest opportunities to grow are often, you know, based on the places that we learn from mistakes that we've made. And I can remember a specific point in time where, again, this was around health IT, where I was told that I needed to make a change in core operating systems that I was using at that point in time. And I dug my heels in and was adamant that we weren't going to do that. And probably lost a decade of my life in hearing all of the reasons why, you know, I needed to, and it needed to be done. And I probably, you know, would have won more favor and ended up implementing the system anyways, right? And so, you know, picking those places where you want to dig in and understanding the broader picture, right? I mean, I was thinking about it from the perspective of the area that I led and not what was best maybe for the overall organization. And so stepping back and now thinking about things from a system view, right? And an ecosystem view, I think I learned a lot from that particular situation on how to think more broadly.
Great. We're just about 10 minutes till we finish, but do you have anything else that you'd like to add?
Yeah, I mean, I want to encourage, you know, all women, particularly young women, to continue to look for opportunities to learn and to grow in healthcare. And so pick an area that you know nothing about. I'm doing some stuff now where I'm helping mentor some graduate students around, you know, new kind of commercialization areas, and one of them is around skin perfusion, which I know nothing about, right? Like I'm like, I don't and so I'm doing some studying right now before I meet with them around their kind of business ideas so that I can know something about skin perfusion. So I would continue to challenge everybody to continue to learn and grow. It doesn't have to be in a formal education setting. Maybe it's through a new project or a resource group that might be available at their work. Maybe it's through mentoring other young women or finding a mentor, right? But that ability to continue to learn and grow, I think, is really important.
And I guess, how would you make the healthcare industry more attractive, or how would you make it sound more attractive to the younger generation? You know, differing from the other tech fields that are a little bit more glitzy.
And when I was, again, I mean, health tech, when I, one of my first administrative residency jobs was to barcode a bunch of lab equipment at Children's Hospital of Pittsburgh so that they could use a newfound Excel Lotus software tool to put together depreciation schedules. So that was kind of the health tech back then. I think healthcare is a calling, Rachel, right? And I don't think
Mm-hmm.
we sell enough around how we're each called, right, to care for others. And even in the tech space, a lot of what we do supports individuals who are doing work to care for individuals. And so I think it's such an attractive industry for those that want to give back and care for others.
Mm-hmm.
I think we just have to talk about it more, right? And make people
Mm-hmm.
understand how what they're doing every day connects back to the bigger picture.
Right. No, I agree totally. Um, I'm just looking to see if the audience has any last questions. I guess someone asked, does representation impact patient satisfaction and trust in healthcare providers? Which you touched on a little bit, but if you could go a
Yeah.
little bit more in depth, that would be great.
Yeah, I mean, I think understanding where our patients come from and having representation across the leaders who are leading organizations, the caregivers who are caring for individuals is extremely important, ensuring that we are providing care that's culturally competent and sensitive, and really thinking through how do we engage people in meaningful ways, which, I don't
Mm-hmm.
know that we've always done. We focus so much on standard work. And I have an example. We have a minute or so, so I'm going to give this example.
Mm-hmm.
So I entered one of the organizations I was working with, and I had hundreds of care management or nurses who were doing wonderful work. And they came to me and they said, yeah, Ruth, we make 3,000 calls, a day. And I'm like, okay, how many people answer the phone? And they're like, 260. And I'm like, well, that
Mm-hmm.
means you have, 2,800 wasted phone
Mm-hmm.
calls. Why do you think people aren't answering their phones, right? Well, we were calling during the day when most people were at
Mm-hmm.
work and not on weekends. And we weren't utilizing technology. We weren't engaging individuals um, in the ways that they wanted to be engaged, and we didn't
Mm-hmm.
have messages that resonated with them. And so over a period of about a year and a half, we changed how we were doing the work and the messaging that we had, really to meet people where they were.
Mm-hmm.
And I think continuing to learn from some of those things and having people who are representative of the communities that we serve,
Mm-hmm.
that help guide how we do our work and what we
Right.
say, is extremely important.
Thank you. Let's see if there's any other questions. I guess you already addressed
Yes,
what are the views
Angelique.
on the.
Yay. Yes, not all outreach is the same. It is not. I'm really hard. I have a hard time following the question or the comments at the same time, but that's a very true statement.
Um, yeah, and I think one last question is, what are your views on the future of women's health tech?
I think some of the best and brightest technology opportunities that I've seen in the more recent past are being led by women and developed by women. And so I think it's an opportunity for us to continue to push the envelope. And again, I'm going to use another example, which is, I mean, nobody talked about menopause before these last few years, right? Like you would never talk about menopause at work. And now we're finally talking about, what does menopause do to women who are leaders, who are my age, right? Like, and we are tired and have hot flashes and,
Mm-hmm.
all of those kind of things, and foggy brains sometimes. And I think having women leaders who are thinking through, how do we support women, not just in tech, but women in the workforce, whether they're young women who want to have families, right, and supporting
Mm-hmm.
them through that process, and through aging, I think is I'm excited about where we're at. It's very different than where we were when I entered the workforce
Mm-hmm.
30 years ago.
That's great. And that answers one of the other questions was, do you see things going in the right direction? Which you said you absolutely do. So.
Well, we still have a long ways to go, though, right? I mean, I think there's still a lot of things where, equity and pay and some of those other things aren't where they need to be, but at least we're
Mm-hmm.
making progress. Maybe not as fast as we could or should, but we're going in the right direction.